Lightspeed Health, which is part of the Kantar Health Company, has done some incredible research around what technologies are showing the most promise for consumers. So yesterday I talked about, consumers in the driver's seat, which I've been talking about year after year after year, but we're really getting there, like it's really happening. So I'm really excited to welcome Matt Titus. You can come on up here as a VP of Business Development of the Americas at Lightspeed Health. Welcome into the stage.
Good morning. So my name is Matt Titus, and I'm the Vice President of Business Development Americas for Lightspeed Health, a Kantar company. If you're not already familiar with Kantar, Kantar is the world's largest data and insights consultancy. In early 2018, Kantar formed a health tech thought leadership team, incorporating consultants with expertise in pharma, healthcare, technology, and consumer behaviors to study the sector and understand the opportunities at hand. To do this, we really took a three-pronged approach. The first thing that we did is we poured over about 20 years of existing syndicated data among physicians and patients. Secondly, we researched 2 to 3 years back currently published articles about the industry, everything that we could get our hands on. The last thing that we did is we did research on our own. So where there were gaps missing in the information, we ran surveys with physicians and consumers to understand attitudes and behaviors within the marketplace. About 6 months into this, we started to see a conclusion here. And that's that health tech right now is a revolution at bay, and significant steps need to be taken in order to help health tech reach its projected potential. We'll come back to that in just a minute. I think it's important to understand how we got here, and that's to look at the healthcare delivery model traditionally. A patient's relationship with their healthcare provider has been a top-down affair, with physicians, institutions, payers, and hospitals in charge of decision-making. Patients were really constrained to mostly approving courses of treatment prescribed by physicians for them, with little opportunity or ability to assess these decisions otherwise. In the late 1990s, we saw a big shift. One of those shifts occurred with the invention of a website called WebMD. Now, as a patient, I could go online, enter 2 to 3 symptoms, and have information at my fingertips about a possible diagnosis or disease. I could do research on my own at home. Another thing that happened was before Yelp or Uber, a company called Healthgrades came online. Now, as a patient, I can go online and rank my doctor and crowdsource information about how the community perceives his treatment or her treatment to me. With the advent of newer technologies that can provide additional critical data, information, and guidance to patients, we're starting to see a larger seismic shift emerging, one where consumers are being empowered and enabled to take a much more active role in the day-to-day understanding and management of their healthcare. The opportunity of healthcare technologies such as web-connected mobile health devices and applications is certainly significant, but general lack of awareness of such devices amongst consumers and a reluctance among physicians to recommend them is holding this revolution back. We're awaiting better marketing and education to unlock its potential. So let's look at some of the signs of this emerging revolution. In the past 3 years, we've seen significant growth in the use of health-related apps, wearable technology, and the adoption of mHealth devices for the purposes of monitoring patients' health and fitness. Telemedicine is already a well-established part of patient care, with nearly 5 million adults having benefited from it in the past year alone. That's a 35% increase since 2017, and telehealth has a projected market value of $35 billion by 2025. As astonishing as this growth appears, the full potential for health tech has really yet to be realized. Estimates have the digital health market growing to nearly $380 billion over the next 5 years. Telehealth care alone is estimated to see almost 28% compounded interest yearly. But this is yet to be realized, and to have a true patient-centric revolution take hold, it's essential that digital health companies, pharmaceutical manufacturers, and other industry stakeholders understand attitudes towards such devices. So let's take a look at where we are today. We're first going to look here at health-related smartphone apps. With 85% of Americans owning smartphones, it's really not surprising that smartphone-based products are currently the most accessible to patients and used by the general population. Well, we see that most of these health-related devices are aimed at tracking three things: fitness, diet, and sleep. And while the use of health-related apps has increased 25% since 2015, it really still makes up a relatively small percentage of the population. The number of health-related app users varies by age, but what we found is that the biggest users are millennials across the board. Now we're going to take a look at wearables. The use of wearable technology to manage general health and wellness continues to increase, with about 21% of American adults using a wearable device to manage their general wellness. Revenue here is expected to grow at a rate of 5.1% annually over the next 5 years to about $3.7 billion by 2023. Wearables are used by consumers primarily for tracking steps and achieving fitness goals, as well as monitoring heart rate, sleep, pulse, and blood pressure. It's important for us to note that patients have indicated to us that wearables are easier to use than mobile apps because there's no manual data entry required. However, there are still large concerns about accuracy, so we've seen a slow uptick in healthcare providers who are reluctant to embrace them. Next, we're going to have a look at web-connected devices and smart speakers and voice-enabled assistants. Regulated by the FDA, medical-grade devices are more expensive than consumer-facing devices, and usage of these devices among people with chronic diseases tends to be very low. In a recent survey that we ran, only 9% of patients with diabetes use a web-connected glucose monitoring system, and only 4% of patients with a heart condition use a web-connected base blood pressure monitor. Smart speakers and voice-enabled virtual assistants such as Alexa are also rising rapidly in popularity, and this is a really important category for mHealth tools. Because these tools are voice-enabled, patients indicate that they're easier for them to use, especially those struggling with pain, limited mobility, and chronic conditions. Voice capabilities also provide an experience that feels more personal to patients. They don't feel as though they're interacting with a machine. As of today, about 20% of American households have smart speakers, and that's a 57% increase from last year. That's huge. To fully realize the opportunities in digital health and unlock its potential, it's critical to understand how people feel about such devices. Through this understanding, we can determine where the opportunities for growth can develop. So in general, patients have a very positive view of these devices. Nearly half agree that wearable fitness trackers make it easier to track diet and exercise, and a third feel that mobile apps can improve general health. 40% indicate that they'd be willing to use an insurance plan mobile health app, and almost half say that they would be willing to use a doctor-recommended app. Despite the general interest and acceptance, consumers by and large are unaware of the availability of many of the major health tech devices in the marketplace. 60% of the consumers that we talked to were not familiar with web-connected glucose monitoring systems, and 2/3 of Americans are not aware of web-connected blood pressure monitors. Our data shows that there's a significant marketing need for mHealth companies in order to be successful. Much of what needs to be accomplished here to realize this potential will come through physician education. Although most doctors say they have not recommended any general health or wellness apps or wearables to their patients, 35% of the doctors that we talked to indicated that they would recommend these tools moving forward. If you think about that, there's almost 1 million physicians in the American Medical Association. 35% of that category is 350,000 new customers. For medical-grade devices, the results are similar. About 70% of doctors say that they have not recommended a medical-grade web-connected device to their patients, but almost 50% said that they would. Doctors overwhelmingly agree on the benefits of mHealth devices, 83% believing that patients with chronic conditions would benefit from using mHealth devices or wearables to self-manage or monitor their conditions. Probably most importantly in our data here, physicians say 72% of them would only consider recommending an mHealth device that had been approved by the FDA. So let's take a look at some of our conclusions and what's needed to unlock this revolution. Clearly, the opportunity exists for health tech to positively disrupt the healthcare space and empower patients to take the lead in management of their care. The interest and positive views are certainly there as a foundation for us to build upon. However, barriers exist. To overcome these and unlock the health tech revolution, we must use a deeper understanding of the marketplace for more effective consumer marketing. Additionally, this must partner with better physician education to help overcome the reluctance that many physicians face in encouraging patient adoption. Novel promotions and partnerships can help build awareness of use cases where we look to foster greater integration of these devices into treatment plans. And finally, a concerted effort and greater understanding of the challenges faced today, health tech can move forward in reaching its forecasted market potential and bring about greater patient care and better outcomes. For all of you guys that are interested today, we've provided this QR code. If you take your phone and aim it at the QR code, you'll be able to download the full white paper. Thank you, guys.